Dr. Bukalar, thank you for your presentation. I'm honored to be following you, discussing diversity in cancer care and empowering and supporting families and caregivers facing disparities. The Tigerlily Foundation's mission is to educate, advocate for, empower, and support young women before, during, and after breast cancer. And our visions to end disparities of age, stage, and color. A core tenet of our work is really to lead with compassion and love, offer our patients and caregivers and loved ones healing energy, high vibration, seeing the soul in everyone in their humanity and anyone we touch, and creating a place that's sacred as a space with every interaction that we have. And so through our work, we really work to empower and support people and patients and caregivers and children, anyone who's touched by breast cancer, and empowering them to be advocates for change. Another one of our goals is to eradicate barriers and to improve outcomes and quality of life for women who are younger, those who are at heightened risk, and those facing health disparities and with less access to care. So one of the things I live by is the thought that once you choose hope, anything is possible. And so my story, a quick briefing on my background. I learned I had breast cancer close to 14 years ago. Was diagnosed with stage 2 breast cancer. I had no family history and was 32 years old. I did have a mom who was a trained nurse, and I had watched her my whole life, caring for patients, caring for children who had been abandoned in hospitals, and working with her as a child to, as she worked to train nurses to become lay workers in their communities. And so I grew up in a space of, a lot of caregiving, love, and support. My mother's mother was a teacher in school. She taught kindergarten, and she was also in a caregiving mode as well. And so was my dad. When I got diagnosed, my family just rushed to help. They were so involved. I had a great support system, family and friends that were there to support me and my daughter through the journey, taking care of us, baths, shopping, spending time. And so it really was important that for me to have that support. And some people don't have that, and that's why I want to touch on disparities, how they affect people, especially those of color, Black people, and then how we can work to end disparities and impact those who are really, really much in need as caregivers throughout their journey. So part 1 of my deck will be talking about those going through disparities, the Black patient. In part 2, we'll talk about the caregiving that those populations need. So I want to touch next on our vision to end barriers for Black people in this lifetime. So we found that, as many of you know, that women of color have many barriers to care, and we're all working towards ending disparities in our lifetime. And so our goal is to ensure that we create systemic changes so that every system that impacts a Black woman's lifestyle or lifespan will work with Tigerlily to help to accelerate change and end barriers for Black people. Our history of work our body of work is quite extensive. To save time, I won't go into every detail, but you can see from 2006 until now, we were founded in 2006 and began working in terms of policy on the Hill to help change women's outcomes to women who were younger and of color and or who were metastatic. We worked on the PALS bill to get women access to screening. We created angel advocacy training for women across the country. We launched an alliance around disparities. Most recently during COVID, we pivoted to offer COVID relief and to give patients support at home. So we offer financial assistance to patients who are facing barriers to jobs and financial needs. Our Pure Cat program gives patients over 15 classes a day to work to feel not so alone and be together. We had a virtual ASCO event, launched our inclusion pledge, and we're having conversations now around disparities, Black trauma, and how to have physicians, scientists, and so forth really understand the Black patient, their needs, and work with them to co-create solutions for people of color. And last but not least, we're now planning our San Antonio Breast event. We're truly proud to be partnering with San Antonio Breast and AACR to open up the program in December around disparities. So there are some facts about disparities, which I'm sure many of you know, so I won't go into all of them. But the fact remains that Black women have the highest disparities in terms of younger diagnosis, more aggressive breast cancers, higher recurrence rates, and higher death rates than women who are not Black, white women, and other populations. So what's a barrier? A barrier is an obstacle that prevents movement or access, and we're facing that as women of color every single day. So barriers affect women of color in many ways. There are biases that are systemic racism barriers. There's lack of cultural competency within certain systems. Black people we're afraid of healthcare systems because sometimes they failed us in terms of, unfair practices in clinical trials. There's lack of addressing Black trauma, lack of trusting in clinical trials, lack of adherence to screening or having no access to screening, which causes, high mortality rates. And also there's lack of investment in Black communities, which means to me, not just giving money, but giving time and thought leadership, and also giving people of color the space to create relationships with pharma and corporate America, providers, and really understanding how to co-create solutions. I think oftentimes people have built solutions for these communities and told them, here, take this solution, when in fact, what's really important is to build solutions alongside the patient, working with Black-led patient organizations to empower advocates and who are trusted advocates for these patients in their communities. And so we feel like true partnership entails, working with Black-led organizations, Black patient advocates throughout the design, planning, execution, and iteration of all activities across the healthcare spectrum. So I will skip this slide in the nick of time, and the need to save time rather. This slide goes over our work to end disparities, and it goes through barriers that Black women face when it comes to disparities. The barriers are psychological, they're around literacy, trust, trauma, geography, lifestyle, financial, socioeconomic, and many, many more. And so these barriers impact women of color across different cities and states. We find that women, even who have higher economic circumstances, still face these barriers. And why is that? We want to work to change these barriers over time. So a lot of communities that are underserved, we see that they're not engaged in clinical trials for some reason. They're not represented at the table. Oftentimes we're seeing panels and other discussions that don't include Black women's perspectives. Women of color also find that we're not involved in certain clinical trials and we're enrolled at lower rates because there's the fear, there's medical mistrust and so on. And also we find that even though we're seeing a change within diversity and inclusion, up until recently, we're not seeing a lot of inclusion around people of color across STEM careers, science research, healthcare, and more, and that has to change. So we can make an impact by partnering, working together, again, working together with Black patients in underserved communities, with Black patient-led organizations that are leading the charge to end biases in the healthcare system, and by collaborating to change the narrative for Black women in this lifetime and in our lifetime. And so there are ways you can join us by taking our inclusion pledge, joining our alliance, and helping us to activate. We're now doing a health equity tour across the country virtually, working with people in pharma, in advocacy, in the science community, and so forth, to help them understand how the Black population feels. Again, it's important to create solutions with us, by us, and for us. So please join us to help us work to end disparities in our lifetime. And so I'm going to skip these slides to save time because I only have about 10 minutes left. I'm going to go into part 2, cancer care for the caregiver. This is really important because as you think about disparities, you wonder how people who are already facing disparities are impacted by COVID and all that's happening in our world today. And so we talked about disparities earlier and the barriers that Black women face. Well, some things are exacerbated during COVID because people are losing their jobs. They have even less access to screenings and life-saving treatments and clinical trials. And so the caregivers, their needs are exacerbated at this time. And so caregivers have multiple roles. There's caring for parents and siblings, caring for children and spouses, caring for grandparents, parents caring for grandchildren when their child has cancer, caring for your child cancer patient who's also an advocate, being empathic, caring for a chronically ill child, your team, building a nonprofit who's that's your baby, and building that. The list goes on and on and on. At the bottom, you find yourself. And so as a caregiver, we oftentimes put our parents first, our marriages first, our children first, and our businesses and our patients, those we love, and their families. And then there's us. And so I'll go into tools in terms of how to be a better caregiver for yourself and give yourself support during treatment. During the treatment journey for the ones you love, rather. So I read some statistics that really were startling, that most caregivers are women. In addition, the caregiving has increased to close to 5 million in 2020. Caregivers in this country now are mostly people in the family members. So it's become not as much. We still have people giving care that are hired people, but people who are working in the home are people who are caring for their loved ones during treatment, and that's 1 in 5 Americans. Caregivers are also in worse health compared to 5 years ago. The burdens increased during COVID. And so we find that people who are giving care to their mothers, their siblings, their partners and so forth, and patients going through breast cancer or any kind of cancer are facing a lot more challenges than they were many years ago. This statistic here is really startling to me. So the value of services that caregivers gave has increased, and it's now at $470 billion worth of value of caregiving service, which is equivalent to the amount of money that Walmart makes a year. So imagine how many people are caregiving to those they love for free, which equates to Walmart's revenue. This is very startling. So think about the level of stress, trauma, caregiver burnout that's there, and how we can support caregivers in this process. So just food for thought, as COVID continues to be a problem, caregiving is going to rise and people will need more support during and after COVID. So how do we support people who are caregiving throughout their breast cancer journey and throughout any cancer journey or any journey at all? There's a caregiver bill of rights, which I won't go through in detail, but the most important one I see here is taking care of myself. Caring for yourself is not being selfish. It makes you a better person to care for other people. And there's the need to ask for help, or the right to ask for help as well. Caring for yourself could mean going out, having a good time, taking care of yourself as a caregiver, and nurturing yourself, getting pampered, being okay with being angry, being upset, and also wanting affection, time, and support as well. Here are a few more tips. But I'll go into the impact on caregivers. Again, there's a lot of stress. Caregiver stress is seen as higher when the person giving care is female, because we take so much on as females. When you live with a patient 24/7, when you're isolated socially, when you get depressed, have financial challenges, have no time for yourself, having no lifestyle balance, experience overwhelm, frustration from not having support, or not having a choice in what's happening to your life right now. Caregivers oftentimes also get very overwhelmed, tired, worried, lose sleep, gain or lose weight, are irritated, they isolate, as I mentioned earlier. There's mental health issues. There's mourning your past and your future. And also their physical health becomes poor, and they can sometimes tend to abuse alcohol, drugs, or medication because they're so stressed out and want to cope. And last but not least, we often see caregivers have breakdowns when the caregiving is at the most intense phase or afterwards. So here's my advice to you. Put on one mask and take off the other, meaning put on the mask to take care of yourself And then take off the mask of saying that I'm okay and I don't need any help. Get help for yourself physically and mentally. Build support team, and create an extensive self-care routine, which I'll share with you shortly. So here's my self-care routine, and I call it my self-care routine on steroids. I have one for the morning time, for daytime, for management, maintenance, for nighttime, and again, for regular, just day-to-day, weekly or monthly care. And so as a caregiver, you can do morning mantras, you can do butterfly tapping, you can meditate, pray, be mindful learn to understand your body and how your body feels when you're stressed. I know that when I was going through a lot of stress caregiving for my daughter and my father, who had several heart attacks, and my daughter had chronic health issues, I couldn't really process a lot of life. I was overwhelmed. And so EFT helped me a lot, meditating, time for prayer, being mindful of how I felt and caring for myself. I'm doing deep breathing. I'm taking long baths with Epsom salts and so forth, magnesium, exercising and taking care of my health with supplements and eating properly. Daytime is really a good time to continue the process of being mentally focused on your self-care. I have essential oils with me all the time that I use, diffusers. I do what's called power pausing, where I stop for a moment to walk the dogs or just walk around the house, go out and get grounded, put my feet in the dirt and just feel the ground. You can put on music, make sure you have healthy meals, drink lots of water. I have this big jar I drink every day. It's 2 gallons of water. I think I do half a gallon sometimes, or I do 2, but it helps me stay hydrated, and my body gets what it needs in terms of flushing out toxins. And for those of you who work really, really hard and who don't take breaks, and this might be a foreign idea, but taking naps really helps sometimes, like quick naps, half-an-hour naps. At nighttime, create a space in your room that is devoid of any electronics. Have warm lighting, maybe a sound machine, take baths before bedtime. Have music playing. I use the Calm app, and it has beautiful music that I can go to bed to, or Insight Timer. You can journal your thoughts down, whether you're feeling stressed or creating intentions to go to bed with, releasing what's happened that day. Getting lots of rest. Also, the maintenance part, sorry, I missed my slides. The maintenance part is really important. Those of us who are caregiving don't make time for mental health as we should. And so I begin seeing a therapist regularly for just dealing with trauma, whether it's my own trauma, trauma of taking care of a parent who I thought might have died, or a child who was really sick for a long time. The trauma of losing friends of mine to cancer, and just dealing with that constantly in this space. As doctors, I'm sure you see this all the time. You have loss, but have no time to experience the loss because you have to go to the next patient in person. So taking time for yourself to have therapy is really important. Having a circle of friends that you can talk to about anything, no matter how bad you feel or good you feel, or how scared you feel. I know that I had a hard time saying what I wanted and needed at first, but I began to put together some friends who I realized I could call whenever I needed to call them, day or night, to get support. So build the support team you need. And then also to remind you all that your self-care is non-negotiable. So put it in your calendar as you would a meeting or any other appointment, and keep this promise to yourself. Let's see, next slide. So as I was going through the self-care slides, I made them first, and then I thought about this. When you consider disparities in healthcare, things I mentioned before are things that people who have more access can afford. So imagine going through a lot of trauma and a lot of already having access to disparity issues and not being able to afford therapy, or have time to take a long bath, or affording urban therapy, or affording life coaching, or affording all the things I mentioned in the slide before. We're seeing these disparities for people who are of color, or are of color rather, in the caregiving community. Most people of color, Black people, spend time, more than half their time on caregiving. Also, there's this idea of women of color, Black women like myself, being strong, and people don't see when you're in a place where you're burned out or tired. And so it impacts your physical health and mental health. We find that those who are poor, have a less than a high school diploma, or a child who's chronically ill have worse outcomes as caregivers. And those who are in a place of working hourly jobs or a lower income job, when they have to go take care of their loved ones, it impacts their job security. They don't often have childcare, a less flexible schedule, and sometimes no PTO and lost wages. I know that people who are immigrants like myself, when you're caregiving for a loved one, you are relied on for support. So most immigrant populations who may already be having financial disparities and other inequities are having to give someone care while taking care of themselves, which is also a strain financially, physically, and mentally. This slide is really important because I gave a talk the other day, about a few weeks ago, and talked about disparities in populations of color, Black populations across the breast cancer space. And the barriers that we found around breast cancer and that women of color faced were the same barriers that they experience as they care for patients and loved ones during cancer. And so as you can see, disparities don't really stop with just the patient care. They affect the caregiver as well. And so as we build solutions to end disparities for Black people in our lifetime, we have to consider the impact on the patient and the caregiver. So there's a couple of things that are happening that I think are really powerful, which are in place right now to improve caregiver support. One is giving caregivers tax relief, and the other is called RAISE. It's also a law, which provides for more support for the person that's giving care, for the family giving care, for coordination and caregiving across the entire spectrum of that activity. So we offer a lot of programs within our organization for caregivers. We have patients programs for the patients first and caregivers. So whatever we have for patients, we tend to have similar programs for caregivers to support both the patient and the caregiver to avoid burnout. Again, as a caregiver, keep in mind the importance of mindfulness. The importance of mindfulness means that, creating places to be able to be still, to lower your stress, anxiety, uncertainty, and just support yourself in where you are. As caregivers, we are empathic people. We give a lot, and really, really are hard on ourselves. So compassion for self and kindness. Learn to also self-regulate. You want to give yourself seeds to grow. Learn to say how you're feeling, ask for help, express your emotions, and tell people what you wanted them to know, not just the things that are easy, but what's hard to hear. Speak up when you're not being heard. And last but not least, we offer a guide to caregivers that they can download to help them understand how to manage distress, burnout, and enhance their emotional well-being. Here are the programs again in a pretty format. And so we really encourage you to, think about how we can partner to help patients going through cancer treatment and caregivers when it comes to their health. Tigerlily mission is to educate, advocate for, empower, support, and transform. So please join us. We'd love to work with you. Thanks for your time.